Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here today for a very special podcast with, of course, my faithful and lovely co-host, Dr. Millicent Ravello.
You also did not say diminutive.
I did not. My Napoleonic complex and diminutive co-host. No, just kidding.
That's me.
You're very big, and your presence is so beautiful and large.
Thank you.
And today we have on a very, very good friend and very awesome actress from many, many things, but of course known for her role as one of the princesses in Bill and Ted's Excellent Adventure, Kimberly Kates.
Hello, everybody.
How are you doing?
I am feeling quite excellent to be here and excited to talk about all these things.
Yeah, well, we're excited to talk to you because, you know, this is a topic that, you know, we were just talking, Dr. Ravello and I, about the Millicent, which is going to be the new trademark name of the operation where we do the mid-face lift, lower lids, and brow together because she had this about two
years ago.
Amazing.
Well, thank you. It's the
Gorgeous.
Millicent.
The Millicent. The
Millicent's
natural.
really working for
Yes,
Millicent.
very
Very
natural
natural,
looking.
yes.
Beautiful.
Thank you.
Yeah, I obviously have called the natural lift that because of the way that I hide incisions, and Millicent was kind of like, I don't know how else to do it. I only know how to do a facelift that way because that's all I've really seen is how to hide those incisions. Whereas what we're seeing now is very, very common are, you know, very large scars in the hairline on the forehead to do the brow lift, which is easier, of course. You know, if you cut right here, then lifting is very simple, but it leaves very visible scars. And my concern is my patients, and I'm not speaking for anybody else. You can cut on the face all you want. For my patients, they don't want those scars because they want to be able to wear their hair up, and they don't want visible scars that they have to concern themselves with every time they put on their makeup or go out.
Of
so
course,
that's
I
the
saw
thing.
something horrific where somebody stapled somebody's face all up, like tons of staples after a facelift. It was on somebody's Insta recently. It was some doctor. It was horrifying. And
that may have been the hemostatic net.
It was terrifying.
Oh, yeah, maybe.
So it probably wasn't staples. What they're doing now, and I don't do this, and we'll talk about this on another podcast, but what that is they're sewing the skin down to the underlying tissue. And the idea is that it prevents hematoma for bleeding under the skin and puts the skin in the place where it should be. Not a lot of downside to it. You take the stitches out after 3 days, and supposedly not a whole lot of scarring. However, there is some scarring from it, and that's been my issue with it is my patients, and I do not speak for anyone else doing facelifts. Hemostatic net all you want. My patients don't want scars on their face from that. No. I can't risk it.
No.
It's just not, it's not going to work.
No, well, this looked like it would definitely scar because they actually look like staples.
It does. I could see that.
And it really looked like the face was just going to have like tons of scarring. And yeah, I think it would terrify. It looked like a horror movie.
Yeah,
Yes.
it does. It looks like Hellraiser.
Yeah, it does.
It does.
It does. When I see this, it reminds me, do you know that Terry Gilliam film Brazil? And the woman like has all those threads pulling up like in a million places.
Yes.
That's what I think we've become.
It's
Honestly,
true.
I really do think that. And it's, well, you know why I'm here is because I do you want to do an introduction on it?
Well, why don't you tell us about it? Because you've had some issues with some of the procedures, obviously.
Yeah.
Obviously, we're all trying to look our best. And as this is Hollywood, this is Beverly Hills, I have loads of actors and actresses through here who want to keep looking as fresh as possible. And you've had some issues.
I'm a producer now, so I'm not even in front of the camera. I do in front of the camera work when I do red carpets for China and so forth. And I really hadn't paid attention to my face for a long time because I hadn't been in front of the camera. And then I started to get a lot of offers to do things with Diane for Bill and Ted's. So I had to start thinking about being in front of the camera, and I started seeing some photos, and I wasn't happy with the way my face had looked because as an actress, I always cared for my skin. From my late teens, I would say 19, I started doing Abaji peels. I had perfect skin, no blemishes, no nothing. You know, I would get carded, like, you know, even when I was 40, even now, sometimes I still get carded, but I had perfect skin. And so as I, got older, I noticed that my face got hollow in here. I had hollowing in the cheeks. And I did have Sculptra once, like a long time ago, and that seemed to. But my nana was like, "Why is your face so fat?" So
Well, Nana.
well, it's like she always, she was always critical of my weight and watching me like a hawk. And then she saw a fat face, and that like, I'm not getting Sculptra ever again. So what happened was I got really hollow in here. And then I had somebody put filler. I thought it would make me look younger if I had filler a little bit lower, but it looked weird. And I was dating a doctor, a surgeon. He was very patient. He didn't say anything, but then I saw some photos I thought looked strange. So then I think it was around 2018, I went for my first threads to this woman, Shala from Laser Center. She was great. She just did one thread here and I think one here. And I saw my face and I literally cried. I was so happy. I mean, I could like get emotional just talking about it. I was like, oh my gosh, I haven't seen my face look like that for so long. But nobody tells you at the time, I get facials like once a month or twice a month. If you rub your face or you do RF, radio frequency, it ruins the threads. Yeah. So the thread effect is gone in like literally after a facial in like a week, your face.
And by the way, those threads aren't cheap.
No, it's not. And there's all sorts of threading people that are out there.
Let's just break for 1 minute and discuss what threading is.
Yeah.
Just so we have some background to what you're talking about.
Okay, sure.
Yeah.
So threading, sometimes you'll see it in magazines or on TV as like, a lunchtime facelift or something like that. And what it is it takes these threads, which, by the way, this is not novel. This has been around for decades, but they've sort of come back in style with a newer version of threads. And the ones that are used now are a dissolvable thread that's inserted anywhere around the face, but usually in places that will provide a pull similar to a facelift. So along the jawline, around the cheeks, the eyebrows, and that goes right under the skin. It's literally threaded under the skin, and then it's pulled under some tension. And in doing so, it has these little barbs on the thread that grab the skin and sort of pull it up with it. And so the idea is that you get a little bit of a lift through these threads. And they're not designed to take the place of a facelift, although some people would advertise that it does. And it's not permanent. So usually it lasts 9 months-ish. And then as the threads dissolve, the face falls again.
Yeah, sorry. I didn't.
But in your case.
No, in my case, they were dissolving quickly.
Yeah.
And then, like I said, I go to a really great facialist in Koreatown. And I said, do you know of somebody? So she referred me to somebody in Koreatown, and he's supposed to be a very good doctor. And instead of doing like the single or double like big threads, he suggested I do a bunch of little threads. And so he put hundreds of little needles in my face. And then he did it like 3 weeks later. He's like, you need to come back, because he said it'll fill your face. You don't ever need to use fillers or anything. Just use these. And then what happened, and I don't know if it was because I did that, but it didn't really give me a lift. It was supposed to give me volume. It was supposed to be, and I don't know if it's accurate, that the threading material is what Sculptra is made of. Is that accurate?
Yeah, it could.
Yeah,
It's
it could
probably
be.
a PLLA, which
It
is
is.
a polylactic acid polymer, and yeah.
Well, it's
certainly
supposed
could
to
be.
dissolve.
Right.
And so what happened is then I went to this another threading place that was recommended to me that does like a nice lift. But they do it better because they do more threads, the single big threads. And so they did right in here, they did like 4 or 5, like right in here to give me a lift, because I had a little bit of volume here. But what happened within about 3 or 4 weeks, well, I had noticed before she did it, I started having like these little bumps. And you can see on my face, look at all these little bumps.
Yep.
Right under
You
your
can see
cheekbones
under all my skin, like, I don't even see. I have all this little bumps and scarring, and that was 3 years ago. And I literally went back to Shala from Laser Center. I showed her my face, and she's like, "Oh my God, what happened to your beautiful skin?" She's like, "Oh my God, her son is a plastic surgeon," and she called him. She's like, "You won't believe what somebody did to her skin, her face, because I have so much scarring. It was so pockmarked. It looked like I had a really severe case of acne." And I don't know if the big threads hit the little threads and then the threads coiled, but you don't know what's going on with threading. And I don't recommend it. And I don't recommend it for somebody who has thinner skin like I do. So what Shala did is she really helped me with it. She put Sculptra on. I done Morpheus 8. Like the entire COVID, I spent time doing PRP, microneedling, with PRP, Morpheus 8, which helped a lot, Sculptra, which helped a lot because it was really bad.
Oh, yeah.
I mean, I just thank God I could wear a mask to cover. This side is worse. This side has a little bit. You can see a little bit of them.
Yeah.
You see?
Yeah.
And I am terrified because Dr. Calvert is going to take the scars out for me, which I'm so grateful to you.
Well, I don't know if I can take them out, but hopefully we can make them better.
You're going to make them better. I mean, and that's the thing is like I think you're going to like open my face up and like a whole sewing kit's going to fall out.
That may be the case.
I literally think there's so many weird threads and things that happen because I haven't done any threading since that time. It's just all been correction. And it is better. I mean, it was good enough that I could go to events and so forth and nobody saw it. And I kind of put my hair down and my photos are okay. And I could use like a little bit of filter and it's fine. Like it's okay.
Yeah. I mean, if we didn't know you with your previous skin, then nobody would say anything about it.
Right. It's just because
you lived in California and you've had some sun damage. That's normal. That's kind of what it looks like from here. I think superficially we can treat that with some resurfacing, some very light and easy resurfacing, which we want to be, judicious about because again, we don't know what's still under your skin. There could still be that those threads can last a long time. The absorption time could be, they say, oh, it's 6 to 9 months. Well, it could be 2 years. It could be 3 years. We don't know.
And the other
thing, we'll see.
The other thing is like when I pull up my face like this, I can still see the lines. And a couple of my friends who work in beauty and marketing, they said they would never do threads because some of their friends got the threads. And then when they're talking, they can see the lines moving.
Yeah, there's an animation deformity because the threads are static. They stay in one place, but the rest of your face sort of moves around it. And you get this obvious demarcation of where that line is.
Yeah, it's strange. So you have to be really careful with them. I think people with like a thicker skin or a fattier face can handle it better than people with thinner skin. I really love Sculptra. I think Sculptra is an awesome filler. And I think like if I were to go back, I would do Sculptra, Morpheus 8, like a little Restylane on the cheekbones, like, a little bit of like our what is it? Is it Restylane or what do you guys use? Voluma.
They're all
hyaluronic acid. Yeah. I would just use that because it's dissolvable.
Yeah.
And I think the Morpheus 8 is awesome. I think CO2 lasering is awesome. And you get a great effect. And it could last, you could do that a long time before actually having to do any kind of surgery. But I loved what the lift did. It really reminded me of like when I was in my 20s or 30s when it like how just it lifted. It looked so great. I literally went to my car and was taking all these selfies. I was like, oh, no filter, no nothing. It looked awesome.
Yeah.
But it's great. But how much money and time and emotional upset I've had over this whole experience and trying to get help for it, I would have rather just done a natural lift on my muscle right here. And I would have saved so much time and effort. I would have made more money as, working because the time out and, whether you're red or you have bruising or your face is swollen from these other procedures, it would have been a one-off with just like getting a muscle, like my muscle lifted without like, I don't even know if I needed any skin cut or anything. I just needed like a muscle lift.
Right. And that's what we're going to do is we're going to do a subperiosteal, basically upper facelift where the incisions are up on the basically here, which is about a half inch back from your hairline on this little crest, which is called the temporal crest. And the incision is maybe an inch and it's hidden in the hair. I mean, can't see them. I'm looking at Millicent.
Yeah, you look amazing. I would never ever know you had anything
they're in there.
done.
You gotta go
hunting
find
for them. Yeah.
But the hair goes back through it.
Gorgeous.
Well, thank you.
Yeah.
But I mean, if you've ever listened to these podcasts for any length of time, you'll hear me rail against all sorts of things. And to be fair, we are plastic surgeons doing a podcast, so
we like operating.
I know you guys like operating.
It's a little bit surgery skewed.
Okay.
But what I've always
biased.
what I always say is like I don't like things that camouflage the problem. I'd rather just fix the problem. So I'm very judicious with fillers. I do like things like the Morpheus and things like that, which will actually tighten the skin and give you that lift. And then of course surgery I'm a big fan of. Because yes, exactly what you said. You can do all of these lesser invasive procedures, spend a lot of time, a lot of money, and then at the end of the day, you might have just been better served going straight for a surgery, fixing it all at once, and then moving on with your life.
No, it's so true. And had I known what I know now, I would have definitely done it. I thought I could. You're trying to cheat time, essentially.
Yeah.
You're cheating time by doing it. It looks great temporarily, but you know you're going to be back there in 3 or 4 months. You were talking about the temporary effect of like the fillers, the Morpheus, this sort of thing.
Right.
The thing that I'm concerned about, Dr. Calvert, and this is going to be like an after you do this procedure is, and since you're a doctor too, you surgeon, my concern is when I pull my face up, there's like these marks here. Like when my skin's kind of hanging down, you can't see the marks. But when you pull it up, I'm wondering if there are threads in there or if I'm going to need further help, like with a fat transfer or Sculptra, because there are like these indentations, like I have acne, like acne scars. See when I go like that?
Well, with this subperiosteal lift, basically I'm lifting the entire thickness of the cheek off of the bone. So the skin doesn't get pulled. What happens is I redistribute the entire cheek and this area here, the submalar area. This whole thing gets elevated with a device called the Endotine device. I either use sutures or the Endotine. For you, I'll probably wind up using sutures because you don't need a big, heavy device. You don't have big, heavy cheeks. And then I'll use those sutures to lift the cheek, lift the side of the orbit, basically the cheek skin here that's over the bone of the cheekbone, and then all the way up into the forehead. And with a series of those sutures, I get a massive lift without stretching skin. It's not a skin lift.
I see.
It's a
so
composite
this is so
facelift.
even when you lift, this is like this part. If I have any marks here,
They won't show.
They won't show?
No, this is what you're doing is called finger surgery. And finger surgery, finger surgery stretches things. That's different. So finger surgery.
Yeah, I know.
Never
I used to
looks
watch
good.
my mom always doing this in the mirror the whole time. I'm like, why is she doing that?
She's doing
Now I
surgery.
understand. Now I understand.
Yeah, so finger surgery is not what this is. I lift the entire cheek mass, which does translate through the skin. Basically, your entire cheek and the brow and the skin of the, sort of on its way back to your hairline, all of that moves north, probably by about a ½ inch. And so it redistributes the cheek mass, and that's what makes it look very youthful.
I see. That's what the threading did.
Right,
somewhat.
the threading did that
Right,
on a very temporary basis.
Right.
This is being done down on the bones so that, and I'm over the cheekbone and down onto the masseteric tendon, which is this chewing muscle here. That entire composite cheek lifts up through a small incision with the guidance of an endoscope. So it's done under direct vision, but it's a minimally, like, the incision's this big, and it's a big operation done through a very small incision. And people say, well, why doesn't everybody do that? I said, because it's hard. It's actually a hard operation. And it's not, people don't want to do it. They'd rather cut on the skin of the forehead, lift the skin and pull it up. And then the patient, which is easy and very accurate and looks nice, except for the scar, except that you have a very visible scar in your hairline here, which I don't like. That is my opinion. Those who do it, good on you. It's not a problem, but for my patients, they don't want that. If I do that for you, then the hair up thing is over. And so
then you're
no
just
good.
self-conscious of another scar. That's
On
not
your
good.
face.
Yeah, on your face.
Like this right now, I would be looking right at that scar on Dr. Ravello.
I mean, they do have great lasering and microneedling and all that,
Still
but
a
you could
scar.
still get
It's still a scar.
Yeah,
And
it's
from
still a
this
scar.
distance, it's visible. From this distance, maybe. From 10 feet away, no, it's not. But
Now,
for distance,
one
it
other
is.
concern that I have is because of the scar tissue here, the skin's very tough. Like you can't put like a 30 gauge needle; it won't barely go in. When you put the device in there, is it strong enough that it can because the scar tissue is thick here from the needling?
Yes.
I mean, and do you think it's the actual putting so many needles in the face that could have caused the scarring, or do you think it was the product on the needle itself? I don't know, that created all these like little weird bumps.
I think it's the product itself creating a ton of scar tissue underneath. So you may or may not still have a sewing kit in there, but most of that's probably dissolved. But what's left behind is scar tissue that's not pliable, it's firm, and it creates these indentations and pockets
Yeah,
of
that's
fullness
exactly
and scarred
right.
down and full and scarred.
Exactly.
And so it's it's not that there's still product in there necessarily, although there may be. It's that the tissue itself, probably because you had so many of those little tiny threads placed, it just caused this scar reaction in the whole area.
I mean, I would never in a million years know to like even that was a thing to do, is put a bunch of threads in your face for volume. And anyway, it was shocking when it happened. And it happened relatively quick after he did it, because I remember I had to go to a big event, and it was in January of 2020, and I had done it like in October or November 2019. So it was all right before the pandemic. So I was literally had all these bumps on my face during the pandemic. That's why I did so many treatments with the Morpheus 8, with the CO2 laser, with the Sculptra, and the PRP. Those were like the 4 things that really helped it, because it was so bad. But I had this really big event, and I was taking photos with a lot of celebrities at the event, and all the pictures, it looked like I had all these shadows on my face, like these dark spots all over my face, which was so weird because my skin never photographed like that. And then that's when I started realizing that it had left all these scars and all these, because that's what it does, is it leaves like shadows everywhere.
It's those indentations.
The indentations.
From the scarring creates shadows.
Yeah, so then I had these photos with all these indentations out there, and it's just like, oh my goodness. But it was so upsetting because, like I said, I took care of my skin my whole entire life. I was really diligent. I'm not diligent or disciplined about everything in my life, but I certainly was with skincare. And so when this happened, I wanted to share my story so nobody else has to go through it.
It's tough.
Yeah, that's hard.
It's really distressing.
Yeah, it is, because it was like it was just like there was no solution. And that's the thing, is I was dating a surgeon. He's amazing. He did notice at first that it really looked good on me. He's like, yeah, it totally looks great. It makes sense to use those surgeries, because although he doesn't use that when he does surgery, he's like, it makes sense to use that, and he could understand how it worked, how it would elevate the skin and so forth. He thought it was a great idea at first because he saw that it created a beautiful effect. But then he did notice, he's like, what's going on with your face right here? So he pointed it out, and I was hoping nobody would notice, but of course he would notice it. And again, it got worse before it got better. And I went to even some like really famous dermatologists, and they were injecting it with like a chemo kind of whatever they do, whatever that chemo thing is.
5FU probably.
Yeah, and steroids and different things to try to like shrink the scarring, and all that did was like indent it more. So that's why this woman Shala from the Laser Center, she's the one that did the sculpture on it, and it really 50% like better after she did that.
Well, I think at this point, we'll move you up, and get everything looking great. But I do think that some superficial treatments and more Morpheus and maybe some fat grafting, because that may help a little bit too, just to kind of help smooth out all that stuff that's under the skin that's causing that. But I think when we move this north, and we go up with it, it's going to look a lot better. I think you're going to be very happy. So,
all right.
We'll get it looking good.
Well, you are a genius. Well, I do think you're amazing.
I just work here, but thank you.
No, I think your work is really outstanding. I really do.
Thanks.
I'm not just saying that because I really mean it. You do a great job, and you really care about your patients.
Absolutely. I mean, I think people are trusting me with their face, and I mean, look, who I wind up operating on. These folks their face is a huge part of what they do, whether it's, a plastic surgeon or an actress or whatever, a lawyer. For some reason, 20% of my practice is lawyers. And more lawyers as patients. Like if you need a lawyer for anything, I got them. They're all my patients. They're here.
That's hilarious. Well, I don't know. Are they even, maybe they're in the courtroom. It is a sort of a theater there. It's a performance. You want to look your best.
Yeah. Oh, my lawyers are very concerned about how they look, because they're concerned about that the Botox not be too strong, because they're in mediations and they have to emote. They've got to put on a show, right? It's part of the deal. But we really appreciate you sharing your story. It's really important. Yeah. Let me ask you a question though about your Bill and Ted's actors. Have they all kept up looking as good as you? I mean, Keanu looks like a
He looks amazing.
Like he's like 18 years old. That guy's
I
just
don't know what
amazing.
he does. Honestly, I don't know. I haven't seen him in a long time. I've seen Alex more recently.
Yes.
Alex looks like they have very boyish qualities about them. And when you have that boyish quality, it's like it doesn't matter what your skin looks like because you're still so young at heart. Diane's the same way. Diane's kept everything really natural. I did try talking to her about doing some things, and she would consider it in the right situation. But yeah, when I went to the Bill and Ted's event recently in Cancun, everybody's like, "You look so young. What is your secret?" and all that. And I'm like, just don't look at my cheeks. Don't look at all the scars. But no, they were so sweet. I mean, the Bill and Ted's fans are literally like the best, most fun, and like all that whole 80s, like 80s and even 90s, like is so popular right now, and it's such a fun era. Both eras were really fun. At least I had a great time in the 80s and 90s. They were the best. But yeah, everybody, like, it's sort of just the young at heart making you feel young kind of thing. And it does keep people looking just so vibrant. And that vibrancy, like some people that are young with great skin can seem really old, right? But but it's because of their attitude. And Keanu and Alex and Diane, I can say all have I look at them and I still see them, as 20-year-olds. So
For sure. I mean, I saw a funny thing on TikTok with Keanu on his TikTok, and it said, "What is Keanu Reeves doing? He looks so young. He must be a vampire." And then he was like, kind of like acting it out. And then he was like, and he picks up a big red drink and sucks it
that's
down and
hilarious.
smiles with like the blood in his mouth. It was really funny.
That is funny. Yeah,
He's a funny dude.
he's funny. He's got a dry sense of humor, and
Totally.
he only lets a few people into his world, but he's really, really cool. He's such an artist. And yeah, I think he's kept things pretty natural and pretty real. It's kind of his whole vibe. So I don't think he's done too much. If he has, be like really minimal, like probably just using his blood as a facial, right? Because Jared Leto talks
PRP.
about that. Doing the PRP or PRF
Yep.
is like awesome for your skin. It's like I was pre-med in school. I could draw my own blood, and I have a centrifuge.
And there you have it, folks.
That's why she looks
Home
so good.
PRP. That's the next fad.
Yeah, I know, but don't do it. I was
try this
pre-med. I did do phlebotomy. I still have the nightmares of all the girls poking my arms 10,000 times trying to find my vessel.
Learning on each other.
Yes.
Yeah, I had my classmate put a huge hematoma on me when she
Yep,
drew it.
for sure.
In fact,
Yeah.
you know who it was? It was Anna Kwong, who's a USC faculty.
Yeah.
She was my classmate
where
at
she is
Cornell. Do you have any questions for us? Anything that we can answer for you?
Well, I think there is still not I think when somebody says facelift, they think of this windblown, pulled look, kind of really horrible. Like when I hear it, I think, oh my God. But I see your face, for example, I would never ever guess. But now it's so different than even 20 years ago, 10 years ago, where you lift the muscles now and it's more of a natural lift, right?
It just depends on who you go to and how it's done. And pretty much, I know guys that do very superficial facelifts and they make them look great. And I know guys that do deep plane facelifts and they make them look great. And I know the opposite of both of those two, people that do both those techniques and they turn out terrible. They look very strange every time. But, some patients, as we talked about on our Natural Lift podcast, some people really want to look weird. And they
want people
to
to
look done.
know they've had a facelift.
No.
So
I just want to look natural. I don't care. Everybody's going to know that, you lifted this and helped me with this situation.
Sure.
But I just want to look natural. I want to go back to more my natural look before all this mess happened.
Right. The thing is you want to look vibrant, healthy, and normal. That's sort of my vibe when I do facial aesthetic surgery. Mm-hmm. We said some people really want to look weird. We coined it the mantis lift.
Mm-hmm.
They want to look like bugs. They really look strange.
Super pulled, eyebrows up, cheeks up, all hollow and
kind of
tight.
just.
I don't know. Is it because they're trying to look like an anime character, or is it they're trying to look like a cartoon? I don't know. Is it?
I think they think the tighter they're pulled, the better the facelift they got.
Really?
It's
I told a few stories on that podcast about people coming back to famous surgeons saying nobody knows I've had a facelift, pull this thing tighter, or I'm gonna ruin you kind of stuff, and then they had to make them look strange, and
Oh
then
my
they were very
gosh.
happy. But my theory is that those people that want to look that way are all aliens that are metamorphosizing so that they can find each other
Oh, they're
and get together.
they're the
and go back to
lizard
the
people.
planet.
Well, I just went
That's
to
right.
Alien Con, and like, makes sense now.
Now you get
Yeah,
it.
Yeah.
see, now you sound some
They
people.
were there.
Yeah, they were there. Well, they weren't wearing masks. I thought they were.
There you have it.
I have a question for you. I dissolved all the filler in my face.
Okay.
And I like my face better without the filler.
Yes.
I really do.
know.
I mean, this is my face with no filler in it. And I haven't had Botox in a while. I was going to ask you, I shouldn't do Botox before this.
Not right now. We'll do it afterwards. I use Botox as part of the healing. So once everything's where I want it, then I'll take out some of the muscle movement with Botox to really enhance the healing.
Oh,
So, yeah,
interesting.
I have a lot of tools. There, like I said, this is a totally different experience than getting it done somewhere else. It's just I have a whole thing that I do, and that's why I've kind of had to bring it forward that way, because it's why I'm speaking at the German Society, or the German Academy for Aesthetic Plastic Surgeons in 2 weeks, and they asked me to come because they said we want to hear about that. We get it. We are tired of seeing these big scars all over, and it can be done this way, and you need to tell us about it.
Yeah, that's great that you're teaching other doctors to be. It's basically being more efficient. And if it does take some more work, I mean, yeah, I understand, because Dr. Lee, I was with somebody that doctors prefer to do hysterectomy rather than his procedure. So I totally understand. He does the Acessa fibroid procedure. And so I understand, like, there is doing something new is very slow to turn in the medical world.
It is.
Yes.
And I've
Yes.
been doing this since 1997, as a matter of fact. I mean, that's
Yeah.
really when I took to the endoscopic upper facelift, really from the guys who pioneered it at Emory University, Rod Hester and Clinton McCord and Fuad Nahai, who we were talking about earlier. He's at the point he's retiring from his editorship of the Aesthetic Surgery Journal. But Fuad was one of the guys at Emory who really espoused the concept of these minimal incisions. And I was a very impressionable medical student at Cornell in 1993, watching these guys do these big operations through small incisions. And I just said, that looks good to me, because I didn't like I grew up in New Jersey, and around New York and New Jersey where I was, people got some pretty bizarre facelifts in that day.
Yeah.
They really did. They looked wacko.
That was the time and the place.
It
yes.
was.
Yeah.
And it was skin lifts. It was
That's what I like.
Weird.
That's the thing that I was like always terrified about, like even the word, because I just think like this windblown look, and it's just like, yikes, you know?
The corners of their mouth or like up by their ears.
No, I literally saw somebody that I knew, and it wasn't even that long ago. I'm like, oh dear, what happened? You know, and
it's still going on today.
you know,
It
it's
is.
still, and I just, you know, there are so many alternatives. Like that's what I was trying to do, because I tried keeping my face as natural as possible and doing all these natural methods and having no surgery on my face other than a broken nose when I was really little. But that, you know, trying to keep everything as natural as possible for as long as possible. But now it's like advanced so much, just like regenerative medicine is advanced. I mean, this is also, I see doctors using like PRP and stem cell mixtures and fat mixtures and all these really interesting, more holistic approach along with the surgery, which I think is like what you're talking about a little bit, like using the Botox after to make the muscle suspend it from doing whatever it's doing so it doesn't contract.
Exactly.
Yeah, I totally think that's the way to go. And I think that minimal scarring is like what people prefer. Absolutely.
You would think so. I mean, you would. I just, that's kind of why I'm making a lot of noise about it.
Yeah, well, you
why,
should.
Why I appreciate you coming and telling your story.
Yeah, and I just want other women to know that threading, because even like recently before I came over here, I wanted to see if there was any, like when I searched Google, does threading leave scars? No, it doesn't. It dissolves right into your skin. I'm like, this
No,
is
it
not
doesn't.
true. And so I just don't want anybody else to like have all these like, you know, hundreds of little bumps under their skin, and it's like literally pulling my skin down right here. Yep. And I just don't want anybody else to have to go through what I did, because it was a lot of unnecessary pain and suffering in my home alone during the pandemic. I still had a great time, but I was very, very creative, but I just didn't really want to see anybody. And I was glad that we weren't seeing anybody, because I was dealing with this issue.
Yeah. Well, we certainly appreciate you telling your story. And I think it's really important to get that out there because even though it seems like it's a non-invasive, like quick lunchtime fix, like these things have real problems and potential complications. It's not a benign procedure.
Exactly.
So I think you telling that story is really, really helpful.
Yeah. And it's not doctors being sour grapes or anything like that with like, oh, don't do threading because you should do surgery. It's really because it did damage my face. It did damage my skin. And now I'm having to do the thing that I didn't want to do, which is to do surgery. But now I think it is such a better choice than having to do like the lift every 3 months or every 6 months and the whole process. I just wish I would have done that in the first place. But yeah, I mean, that was something else I wanted to say. Oh, when you're doing the threading, you just don't know what's going on underneath the skin. Like nobody's using a scope to see, well, what's happening here? Are there like little threads that are like jamming into the big threads? Are they having a party in here? Are they all mixing and dancing in my face? Or, are they coiling? Are they fishing in there? What are they doing?
You don't know.
I don't know what's going on with these threads inside my face. I think that, like I said, you're going to open my face, and that's what I want you to do. Is I want you to see if there are any threads. Like make a little pile for me because I'm going to take photos of them.
I'm sure there won't be, and I won't be in the space that they're in unless I wind up there, which I was going to say back in the day, Dr. Ravello, before you were probably in medical school, these threads were around, but they were made out of permanent suture. They were made out of Prolene, which is a plastic polymer that does not absorb.
Oh, wow.
And so I would go in to do an actual facelift, and there would be like these barbed Prolene sutures that I'd have to fish out of the face. And they were always surrounded by a good scar sheath. So they do make scar. And even if they absorb, they're still going to make this scar sheath, which is what I think we're seeing under your skin. And, quite honestly, I'm happy to not be going there because that is going to, it could scar down in a very awful way. So doing a composite lift for you is more beneficial than having to go through all that scar that's under the skin. I think we should treat it, but we shouldn't treat it by cutting it. Because the way that it could scar down
be horrible.
10 times worse.
Oh my God, really?
Yes.
That's probably why when they were injecting that chemo drug, it looked like it scarred down. It like flattened and looked strange. Yeah.
Well, we're going to make you look great.
Weird.
I may do a little fat grafting. The fat grafting I think could be very helpful for that. So I'll probably put 10 cc's of fat kind of all throughout the skin as like a PR, basically a aggressive PRP treatment to help smooth all that.
Oh, I love that.
Yeah. So I'll probably add that in there as just a little bonus for just to try to smooth that out. But I think elevating it and getting it in the right position is going to really do wonders.
I'm really excited, and I thank you so much for doing this. And thank you. I think surgery is much better than it ever has been and much safer. And I'm really looking forward to this. I'm a little nervous. I'm not going to lie. I haven't had many surgeries in my life, so I'm a bit nervous about it, but I trust you. And I've told you everything that I could about this. So, fingers crossed, and hopefully I'll be back to show the results.
Oh, you better be.
Stay tuned.
Yes, you will be back. Trust me. We believe in survival surgery for aesthetics. I think it's a good idea. Yeah, we're going to go for that. How about
okay, good.
Any other comments, Dr. Ravello?
Nope. I think we hit it all. And thank you. Thank you again.
Thank you. And really, your face looks just outstanding.
Oh. Well, I know a guy.
Yeah. Yeah.
And our guest has been Kimberly Kates. We really appreciate you coming on.
Yes. Thank you for having me. Thank you.
And this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.